Good morning, everybody. Welcome to the second of our events showcasing the Bristol Aging Better evaluation led by the University of West of England. For those of you who don't know me, my name is Carly Urbanski and I am one of the heads of the BAB program. I am so excited to be here today to introduce this event because I have been a part of the BAB team since 2016 when I was working specifically on the Age Friendly Initiative. So I've seen the program grow and adapt and become what it is today. And it's so special to now be here and see the final evaluation all come together. I just wanted to start by thanking each and every one of you for taking your time to come here today. It means a lot to us that you're interested in learning from the BAB program and hearing the analysis done by Matt, his team, and community researchers. I also wanted to thank the National Lottery Fund who have given us this opportunity because it's been amazing. And we've just seen so much change in the city and all of our core team have been so excited to be a part of it. So it's amazing that we've had this chance. One of BAB's original goals was bringing individuals and organizations together around a common theme, which was addressing social isolation and loneliness in older people. We are one of 14 areas around the UK that have the same funding from the National Lottery Fund. So it's great that we're able to feed into that larger network, and we feed in on different scales from around age friendly to learning to what each of our projects have achieved. And our approach was based around having a core team sitting within Age UK Bristol who would run the program on an operational and strategic level. And this core team was dedicated to pushing everything forward and managing work behind the scenes. The goal was then to work with a wide range of partners and primary delivery partners across the city who would deliver the work on the ground. And this approach has been a key element of BAB from the start, with partners bringing different knowledge, experience, and expertise to the table. And we feel strongly that this approach has worked extremely well and been part of the success of the wider BAB program. And even with most of our projects winding down over the last year, we have managed to continue to engage with our wider partnership and feed off their energy and work across the city. And it's so exciting that we've been able to maintain those relationships and connections and continue to look at how we work together going forward. With most of our projects winding down, we've had one that is just really winding up, and that is one of our main projects, which is the age-friendly focus. And this has been one of the key projects that has been a part of BAB since day one and was written into the initial proposal. And this is something that we aimed to embed best practice of age-friendly around the city and work with key organizations and local individuals, work with the council to stick to the World Health Organization's themes and just try and make Bristol a more age-friendly city, make it better for older people to grow old in. And it's amazing to see how far we've come with this work, the momentum that keeps gaining with it, and also to create our plans going forward, which is really exciting. But just bring it back to today, our October series of events marks the beginning of our journey of sharing all of the learning of BAB, which is definitely really exciting. And there's a lot that you can keep an eye out for. There's going to be so many papers coming out and more events going forward. So definitely keep an eye on what we're doing and take part in whichever ones you're interested in. And this is what we've been building up to for over the last 5.5 years. And amazingly, throughout this time, BAB partners have worked with nearly 21,000 older people, which is just an incredible reach. And what's especially compelling is that we now have strong evidence that BAB had a positive impact on the well-being of the older people who participated. And that's just monumental to us. So it's just incredible to see all of this achieved and how much all this hard work has really paid off. So I wanted to thank everybody who was involved and just thank you for being here today. And I will now hand you over to Laura, who will explain more about the event.
Okay, thank you, Carly. So for those of you who don't know me, my name's Laura Thacker. I'm Joint Head of Programme for Bristol Aging Better and have been covering Carly for the past year while she's been on maternity leave. So I'm just going to run through the agenda for today and some housekeeping. So we will be hearing from Amy and Joe from the University of the West of England. They've been involved in the evaluation of the BAB programme, and they'll be giving us an overview of how older people have been involved in the programme and the key learning from this as well. So during the presentation, we will be keeping everyone on mute just so that we can hear the speakers clearly, but there will be time for questions and discussion after the presentation. At this point, we'll be joined by two of our volunteers who will be sharing their views and experiences. And we're keen to open the topic out for discussion with you all. So if you do think of a question or something you'd like to share on the subject, then please save it to the end, and we'll invite you to use the raise hand function when the time comes. We do have live captions today. So if you would like to use this or not, then if you click the CC closed captions button at the bottom of your screen, the subtitles will start. And just to note that this event is being recorded, just so that we can ensure it's available afterwards. So before we hand over to Yui, I would like to welcome Heather Wright, patron of Age UK Bristol, just to say a few words about the start of the BAB journey.
Hello, thank you very much, Laura, that's fantastic. So, and really welcome to everybody again to this second session. The first session in this series was about addressing loneliness and isolation, and it was enlightening and provided really good solid evidence and importantly ideas for future policymakers. And today's session will of course underline the value our older people bring to society today. I just want to remind everybody that we should welcome and encourage that active participation, especially at a time like this, when their experience, that's our experience, knowledge and skills can help steer us all through these difficult times. And many of you attending today's session will be some of the many wonderful people who contributed in whole or in part along the way. And to those people, I ask that please accept a collective thank you to all of you, rather than going through naming individuals again. But some of you will be from other organisations who are taking an interest, so thank you especially to you for coming today. The learning from the whole BAB project is hugely important. It's critical not only for Bristol's older people, but for older people everywhere, and we hope that the learnings will ripple out regionally and nationally, and importantly inform the way city councils across the UK and central government set policy and apply budgets. So to step back briefly for a moment, as I mentioned, so please forgive me if you've heard this story before, I got involved after an event at the M Shed in Bristol, where as an executive producer at Ardman, I had been talking about the power of co-creation and communicating with large audiences. The timing coincided with the launch of the National Lottery's Ageing Better programme, and Kay Libby, who was at the time working for Bristol City Council, came to find me afterwards, and I was keen, and Ardman were keen, to be involved. There was a National Lottery briefing in Exeter a few weeks later, and most cities sent a couple of people to find out more. But there was no mistaking how serious Bristol was when we turned up in our coach and took up about 3 full tables, about 30 of us. The passion and commitment to Bristol, to older people's engagement from Bristol, was evident from the get-go. We had numerous representatives from our voluntary sector organisations, representatives from our city's older people, from the City Council, and I was there too. We had enthusiasm and commitment across all sectors from the outset. And I think when I look back and think, what is it that made the BAB programme work so well? And primarily, I think it was the whole system nature of the programme that pulled all the stakeholders in the city together. Engagement, co-creation, co-delivery and co-evaluation from all stakeholders throughout the whole project. We even had older people trained by UWE as community researchers. It certainly brought some innovative new ideas to pilot in the city, but it was also developed to focus on creating the conditions for change and things like building an age-friendly city. Creating a living legacy and making it sustainable beyond the end of the length of the funding was always part of the plan. There hasn't ever been an approach like this funded by the National Lottery before, with 14 programmes across the country, funded for 6 years. And we are pleased to be able to bring this second set of learning from the Bristol programme to everyone today. Thank you, I really hope you enjoy it.
Thank you very much, Heather. I'd now like to welcome Amy Beardmore and Jo White from the University of the West of England.
Good morning, everyone. Welcome again to the second session in this series of 3 presentations showcasing some of the findings and learnings from the BAB programme. So I'm Dr. Jo White. I'm a Senior Research Fellow in Public Involvement at the University of West of England, and I'm presenting today with my colleague Amy Beardmore, who is a Research Associate in Public Health and Community Development. And as already been mentioned, we have a contribution later in the presentation from one of our community researchers, Jenny Hoadley, and I'm happy to say another of our community researchers, Jan Fulforth, will also be joining us for the panel Q&A and discussion after our presentation now. So today we're going to give you an overview of some additional findings related to the engagement of older people in the BAB programme. And it goes without saying, really, we're not trying to say we have all the answers here. Today we're seeing it as an exploratory session. We want to share our thoughts and ideas for taking this learning beyond the BAB programme. So in today's session, we're going to give an overview of BAB's experiences of engagement, participation, and active citizenship across the project areas, and our learning on what we feel are the necessary conditions for and challenges to engagement, participation, and active citizenship. And then we'll be raising some key issues about, and hopefully have a discussion related to the future prospects and opportunities for older people as engaged, participating, and active citizens in Bristol. Just to recap from what was covered at last week's event, where you were giving an overview of the BAB evaluation, BAB's 3 main aims, which the programme pursued through a systems approach, were that by 2020, more older people to be able to say they have the amount and type of social contact they want to reduce isolation and loneliness, to be able to contribute to their community through mechanisms such as volunteering or being a part of a forum, a steering group, or other activity, and just to feel that they could influence decisions affecting their local area and how services are designed and delivered. So today we'll be exploring the second and third aims. And it's also worth highlighting that the BAB programme always employed what it described as a test and learn approach, trying out different approaches to engaging and involving older people, with the aim of learning from experiences the programme developed and taking these findings on beyond the scope of the programme. So before we go on, we thought we'd try something new. We just sort of pause for a moment to reflect on some ideas and concepts and different definitions of participation, and to get you involved from the outset. So what we'd like to try and do now is a little exercise with all participants using the chat box on your Zoom. So if you could all please find the chat box, which is at the bottom of your screen. And you can see from the picture on the slide here, it's the second icon from the left. If you hover and click down at the bottom of your screen, you'll see a long box come up, and there's a chat option on the second left. If you can please click on that icon, a chat box will appear on your screen that looks something like the picture in the bottom box on the slide. And what we'd like you to do, please, you don't have to do this, by the way, it's just encouraging you to do this. It's just an interesting exercise. You can click on the space there where it says type message here, but we don't want you to type anything yet. You can just all click on there, please. So it's waiting for you to type a message. This is a space where you can also write comments and questions later on during our Q&A discussion, if you like. So if you can just find that place, find your message box. And in a minute, I'm going to ask you a question, and we'd like to have a think about that, and then type your response in the chat box. But please only press send when I ask you to. So I hope this all makes sense. And as I said, don't feel pressurized to participate. It's just something we'd like to try out. What we'd like to do, and think about for a minute, about the idea of active citizenship and what it might mean. So could you please just try and think of a short phrase or word which captures this concept of active citizenship for you? And there are no right or wrong answers, obviously. It's just we want to create a picture of our ideas. So when you've thought about your answer, can you start typing it in? But please don't press send or click until I tell you to click return yet, because we're kind of do this thing called a chat waterfall where everyone's responses come at the same time. So I'll just give you a minute to think about active citizenship and write down some phrases or words or examples that convey the sense of active citizenship to you, please. Okay, can you all press send, please, now, or enter now, please? Okay, hopefully we can save them, capture them in some way. That's brilliant. So thank you everybody for giving that a whirl, as it were. Yeah, that's a really interesting exercise, just to get us thinking about what we think active citizenship could be, but also what we also want to do is sort of discern different phrases and concepts a little bit, because I think the terms engagement, participation and active citizenship, they're referred to often, but they're not always necessarily distinguished. There are many words and phrases associated with them. But so we thought we actually looked into different definitions of these concepts, and we thought that there might be an important distinction to be made between engagement, participation, decision making, active citizenship. So if you look at this slide here, some of the definitions we found. In reference to active citizenship, often there's an emphasis on a sort of higher level influencing, a sort of from civil society to wider decision making, and I think that came up with some people's ideas they put in the chat about making a difference of decisions about the citywide, or influencing sort of higher level decision makers. And if you look at the example for the definition from the European Economic and Social Committee, that's saying that also active citizenship can be challenging the status quo. It can use democratic processes to challenge the rules, try and transform things. The Participating People report from 2019 makes a very clear distinction between engagement or participation, which might be something like volunteering, being in a neighbourhood association, or simply being active in your neighbourhood, and maybe being engaged in wider issues. And active citizenship actually being something about an empowerment process where through democratic decision making, individuals or groups feel that they can actually have a big influence and make a difference. So we thought that maybe there is a helpful distinction to be made here when we analyse our own findings in relation to BAB, and when we examine the role of older people, to sort of emphasise there is a big difference between a sort of local level volunteering and actually feeling you're empowered to make a difference to decisions that can influence everybody in your city or wider. So to what extent are older citizens feeling they're able to influence policy and be actively involved in all the necessary conversations and decisions about key issues, including, for example, how to create enabling conditions to reduce loneliness and social isolation. Perhaps within a time-limited programme such as BAB, it's difficult and ambitious to actually transform active citizenship, and we can discuss that later on in the presentation. But we just wanted to sort of stimulate some thinking about the distinctions that we can make across these terms. Thank you. So now I'm going to hand over to Amy, who's going to give you an overview of some of the learning from the BAB programme.
Thanks, Jo. So yeah, as Jo said, we're going to now sort of present some examples to illustrate some of the learning around that engagement and participation and active citizenship from the BAB programme. So those of you who attended last week's presentation will probably remember this slide that our colleague Matt Jones presented. And it's got quite a lot of quantitative data that's been collected through baseline and follow-up forms, which were completed by participants by way of a wellbeing questionnaire. So although our presentation today focuses mainly on our qualitative findings from our evaluation, this slide is worth referring back to because it's relevant to what we're talking about today. So as you can see, the data shown here demonstrates statistically significant changes for things like social contact with non-family members, social participation in clubs, taking part in social activities, co-design, the ability to influence local decisions, and in volunteering or offering unpaid help. So those are all really positive, obviously, in terms of engaging older people in their local communities and in giving them the opportunity to influence that decision making in their local area. And they're obviously really good findings, but like a lot of quantitative data, it can raise many more questions. So what kind of decision making are we talking about here? What's meant by co-design in this context, and so on. So today and next week, we'll be concentrating on the findings from our many observations and interviews and field work, and digging deeper into those qualitative findings of our evaluation. So broadly speaking, our evaluation found that active citizenship and engagement tended to happen to varying degrees within different parts of the BAB programme and beyond. So most notably at a very localised group and activity level, then in planning of local services within local communities, and then for some at a more kind of citywide strategic level. So many older people were just comfortable participating in groups and activities that BAB supported and promoted at that very localised level, as I said. So they also contributed to the planning of activities, sometimes in a very light touch or low commitment way, whilst others were happy to take more of a local lead. Some engaged by attending taster days and one-off events and that showcased existing local activities. And these days were often places where the older people asked for feedback and ideas about what they wanted to happen in their area, and that fed into the design of subsequent initiatives. Some providers enlisted older people to explore assets and to build on these, especially in some of the community development for older people projects, which I may refer to as CDOP as a shorthand, just in case anyone gets confused. Some areas found that that there was increased buy-in from local people if they were involved in those early scoping activities. Things like door knocking, for example, were better received when they were conducted by local people. And some older people were empowered to run their own groups, which enhanced sustainability actually. And in these cases, participants benefited from attending training in order to facilitate and run their own groups. And courses on offer included things like first aid, grow your own group training, risk assessment, food hygiene, and so on. And this also had the added benefit of making groups much more sustainable in the long term. So one such example would be the Old Market and St Paul's Art Group, where although there was no specific leader, the group all supported each other and encouraged each other to keep the group going. Many community development for older people projects found that in order to engage older people in community issues, they needed to try a flexible, informal approach, or sometimes be very targeted. So there are a couple of examples on this slide from the Linkage network evaluation, and they worked citywide. So these are examples from some of the areas that they worked in. So the example from Clifton here was that a community development worker suggested holding an evening event with stalls run by local organisations because they felt that more people would be able to attend at that time of day. And then there's another example from Linkage's work in Sea Mills that shows that sometimes asking older people about their views on a specific issue, so in this case the community plan, worked well as a targeted activity. And as I mentioned on the previous slide, one-off or pop-up consultation events can prove to be really effective ways of reaching a broad range of people, and they may fit better with people's lives than a more kind of formalised ongoing meeting. And in many ways, this will just depend on the area. So whether there's a history of local engagement or if this needs to be developed, and that sort of thing can take time and be very specific to the local area and the interests of local people. So at a more kind of local strategic level then, I mean, next week we'll be giving a more in-depth presentation about the CDOP, the Community Development for Older People projects that took place across the city. But do come along to that session if you want to hear more. But for today's session, it's useful just to know that these projects were implemented in the areas of the city that you see on the map here, with citywide coordination delivered by the Linkage network, as I said. And each community development project was asked to demonstrate how they would include the voices of older people in more strategic local level engagement and planning. And in response, all proposed some kind of steering group specifically for older people. These were mostly intended to take the form of a monthly meeting or forum, which was intended to involve older people in the co-design and development of local assets and activities for the over 50s within their community, and potentially to use this channel to kind of lobby and influence service provision. However, in many cases, these steering groups struggled to become established. There were a number of reasons associated with why that was. So firstly, aiming them specifically at the over 50s didn't appear to be very popular, and those that later enjoyed some success had incorporated the groups into a wider local steering group that was aimed at the whole community, not just older people. Secondly, many older people felt that they either lacked the confidence or the desire to engage in such a meeting, or they just simply didn't have the time to commit to it. Others strongly felt that they just didn't want to be involved at a strategic level at all. They literally just wanted to turn up at an activity and go home again at the end. They didn't want the responsibility of being involved at a higher level. And lastly, the more successful groups were those that had really clear terms of reference rather than kind of a vague or non-existent aims and objectives. So as you can see here, the Greater Stockwood group, which I think is now called the Greater Stockwood Alliance, set out some very clear aims in their terms of reference. So it was very clear to the group what their aims were. So this all demonstrates that even the best intentions, so in this case, kind of setting out to include older people by establishing that steering group specifically for them, can backfire if you're too prescriptive, and you know, if we kind of aim to treat older people as a separate entity, sometimes that doesn't work. So just to follow up on the previous slide, one of the pieces of learning from the BAB is that all participation at any level is valuable, and people should be encouraged to participate in ways that suit them, as these extracts from St Paul's and Old Market the evaluation demonstrate. So there are also some other things to consider. So firstly, we need to remember that this kind of work is unpaid, and that older people may have health concerns or caring responsibilities that mean they're limited in what they can offer, even if they are willing to take part. And secondly, opportunities for engagement need to be mindful of inclusivity and cater for additional mobility or transport needs wherever possible. And thirdly, although it's good to have some committed individuals who want to contribute at a strategic level regularly, we also want to avoid a situation where the same people are always showing up and coming forward and dominating those discussions. We need to find a way to kind of include everyone's voice. So some CDOT projects hope to recruit older people for specific community volunteering roles that would signpost others to activities and get them engaged. This tended to also be less successful if the idea had not been fully researched to begin with, or if the skills and assets did not already exist within the community. So if there's not already that enthusiasm for that level of participation, it doesn't mean it can't be done. It just means that more time and resources will need to be committed to it, which may not always be available. So you just need to think ahead. This again highlights the need to map assets effectively and plan accordingly, and to be prepared to reevaluate plans as per that test and learn model, and just not being afraid to change course if necessary. Interesting though, the Community Navigators, which was a social prescribing project within the BAB programme, they implemented a really successful model of recruiting, training and embedding volunteers within the Community Navigator programme. And this worked particularly well because the providers of that service were committed to developing their volunteers. They were fully supported, fully funded, the roles were supervised by paid staff, and the volunteers themselves reported that the work itself was fulfilling and that they valued the flexibility that it offered. So one aspect of the BAB programme was the Community Kickstart Fund, which included a panel of older people who assessed applications to the fund. Organisations, groups and individuals were able to seek up to £2,000 towards the cost of activities, and those activities had to be aimed at reducing isolation and loneliness for older people within the city. And the applications to that fund were open between January 2016 and February 2019, and there were 10 rounds of funding applications. And during this time, the fund awarded £229,000, and over 5,100 participants and over 5,000 voluntary hours were recorded over the 3-year period. So it was a really successful programme. And just a few examples of the many, many things that got funded by the Kickstart Fund were a practical English course for older Asian women, which included talks by the fire service, the police and the ambulance services about how to communicate in emergency situations. There was a memory cafe enabling older residents to share their memories of their neighbourhood. And there was a therapeutic poetry, creative writing and visual art group for a small group of older people, which culminated in a performance at a care home at the end. So as I said, a key feature of that Kickstart Fund was that successful initiatives were selected by a panel of older people, and they met quarterly to discuss the applications. So using that independent panel of older people who had good knowledge of community and had their own life experiences in common with applicants proved to be a really successful model of commissioning small and dishing out small pots of funding to people within the city. So another thing that we wanted to mention was the Babbage Show, which has been a great way of informing and influencing through Ujima FM throughout the city. So some of you may be familiar with the show. It runs weekly and is presented by older people on Ujima FM, which is a local radio station and a non-profit social enterprise that promotes diversity and inclusivity. And the aim of the Babbage Show is to provide a voice for older people within the city, as well as to challenge stereotypes around ageing. So we just wanted to give you a little flavour of the show if you haven't heard it. So we have a short clip that we would like to play for you now.
Hello everyone, and welcome to this week's edition of the Babbage Show here on Ujima Radio 98 FM. I'm Eddie Knazel and I'm your host for today's show. As usual, we do have a packed show for you, and as always during the COVID crisis, it's been recorded in our own homes using our own equipment and then skillfully stitched together by our technical wizard David Jeans. Over the next couple of hours, you'll be hearing from other members of the Babbage Show team. Quite shortly, Kerry Possel will be reviewing a book that she's just read and telling us about walks she's taken over the last few weeks. She's been doing more of that during lockdown. And then after the news, Tony Cole will be introducing his latest interview, challenging many people's assumptions about how older people live their lives. But at the moment, thanks to the wonders of modern technology, I'm face to face with Kate McNabb, another one of our regulars.
So hopefully you all heard that okay. That was the wonderful Eddie Knazel there, who I think is here today. So yeah, great that it carried on going through lockdown as well, and continues to this day. So have a listen if you can. So I shall pass back now to Jo, who's going to continue.
Thanks, Amy. And for those of you who haven't listened to BABS, I'd really recommend it. And Eddie Knazel, who you just heard there, is actually one of our community researchers, which I'm going to talk about that now. A different kind of strategic work through the BAB programme was how Amy, myself and other colleagues at UWE worked alongside a team of older volunteer community researchers who were trained in research and evaluation techniques. And they were recruited at the start of BAB to co-produce the evaluation with us. And it's estimated that the community researchers have volunteered around 11,000 hours over the years, excluding their travel. And 8 members of the community researcher team have been with us for the long haul, and they actually started way back in 2014 and are still with us. They undertook a vast amount of fieldwork for the evaluation. They often worked in small teams, pairs, or sometimes alone, collecting data, interviewing people, and conducting observations. And they authored many of the evaluation reports that you'll read as they're published in the coming months by BAB. So their input and their enthusiasm, commitment to the task of evaluating BAB's work has been phenomenal. And but as a quote here we're presenting here shows, actually, it also allowed them to focus on areas of interest themselves and actually feeling they were developing something themselves in their own lives. And a lot of learning has taken place in relation to this joint work on the co-produced evaluation, and also their experiences of older people working as community researchers. And we've written this up into a report, which is now publicly available through the BAB evaluation reports. And those of you who want to find out more in more detail, there's also a video that we'll give a link at the end from a presentation that myself and Jan, one of the community researchers, made at the Gerontology conference last summer, all about sort of reflections about what it's like to be an older person as a community researcher and to co-produce something with UWE. So the relevant links are provided at the end of this presentation. And so now we're going to play some audio prepared and recorded by one of our community researchers, Jenny Hoadley. And we've got 2 clips. In the first clip, you'll hear her talking about some of the learning from our evaluation about creating conditions for older people's participation.
As a volunteer researcher with Bristol Aging Better, I was evaluating an organisation which aimed to help people re-engage with their communities. What we found was that many older people had personal barriers to overcome first. For example, help with managing money, claiming the benefits they were entitled to, improving personal mobility through aids and adaptations, or accessing support for managing ongoing anxiety and depression. As one volunteer I interviewed said, "Getting out of the front door is the main thing, even if it's just into the garden." But once the person had been connected to a group activity they were happy with, evidence showed that their horizons could lift, and they could then move on to being more proactive with their families or their community.
Thanks. So I think Jenny explained really clearly there about how some of the kind of intensive, more dedicated support some people might need before they actually are to enable them to actually participate more widely. And then we're going to play a second clip now where Jenny shares her further reflections on the factors which can enable older people to become more involved, but also the particular facilitating conditions offered by BAB, which she felt enabled her to work better in her role as a community researcher.
A vibrant, sustainable community must be threaded with social networks so that information about what is happening where and resources and support are all easily accessible. This in turn is dependent on embedded community development workers, streams of funding and other resources like access to public meeting places, all of which enable activities to be as long-term as they need to be, rather than here today, gone tomorrow activities. Where such a vibrant community offers opportunities for participation, to the older volunteer, time is a precious asset, not to be squandered. We have other interests and commitments as well. Our health might be variable, and often we don't either have the electronic equipment our digital world often demands, or we lack the confidence to fully utilise it, which younger people often take for granted. Yet, Bristol Aging Better took all of this on board. I felt respected and welcomed for what I could offer and supported throughout. And on top of that, the pay staff did all the boring admin, so I could concentrate on my role as a volunteer. It is in these conditions that older people can thrive in their participation as volunteers and active citizens.
Great, thank you very much for preparing that, Jenny. So in the final section of the presentation, we'd like to pull together some ideas regarding the broader definition of active citizenship, which you referred to earlier, about older people being able to, sort of civil society linking to bigger decision-making processes. So we want to, looking at the link between civil society and decision-making, we thought we'd explore a little the situation in Bristol and what kind of platforms exist for active citizenship, and also we welcome your contribution and discussion at the end. An important channel to mention is the Bristol Older People's Forum, which is one platform which BAB is closely connected to. So this was founded in 1993 and has over 2,700 members. And it promotes the rights of older people in the city by informing, campaigning, and working with key local, regional, and national partners. And works with various organisations all across the city, trying to link older people to decision-making, for example, council consultations that might interest them they could feed into. And in addition, cabinet members and politicians such as the Metro Mayor come to their open forum meetings to promote consultations, for example, clean air proposals, transport strategies. And so the channel can be used to seek the views and opinions of older people. It also, the forum also runs housing and transport action groups, and they've been funded by BAB. And it also conducts an annual survey, which is sent out via their newsletter to nearly 2,000 people. We thought we'd share some of the recent findings of the survey, which UE has been working on with BAB and one of the BBOPF. The fact, it's worth pointing out that this is a paper survey, which means it has a more chance of reaching and including older people who are less likely to complete an online version. And this is particularly important given that 70% of the members are not actively online. And as I'm sure you're very aware, many other consultations are only available online. For example, the Bristol Quality of Life Survey, which is often cited as a kind of barometer of what's happening in the city, is only online, and therefore we consider it's less accessible to those who are not so engaged in the digital world. And as we know, our experience of COVID over the past months, there is a real disparity there, and there's a risk of a widening inequality between people who can actually engage online and those who aren't comfortable with it or aren't able to. And so presenting, just I'm showing you here some of the findings of the BOPF survey of the past few years. We can see that contributions through volunteering and belonging to groups is strong and potentially rising amongst respondents. That's the first section of on the slide. But looking below at decision making and feeling this idea that people can influence decisions that affect the local area, it seems it's lower. It seems steady. There's a steady proportion of people who feel they can influence, but in terms of people who strongly agree with that idea, it's relatively low and steady. So this raises questions about how not to only increase involvement of older people, but how to increase the influencing of decision making. What can we do to change this and make people feel more strongly that they actually do have a voice and they do feel they can influence decision making? So Judith from the BOPF will be on our Q&A panel at the end of this presentation. So hopefully we can discuss this issue further then. In terms of the, next slide, please. Yeah, next slide. So we'd like to share now some reflections from the overall BAB evaluation about what we think might be necessary to promote the role of older people as active citizens. So these considerations came up, firstly about more structural issue about tackling ageism and unconscious bias, so that older people are consulted and encouraged to get involved in decision making at every level across every sector. Also, as has been alluded to earlier in Jenny's presentation, there is a need for wraparound services that offer wider support to older people so they actually have a sort of secure and enabled base from which to build their engagement. Transport emerged in every aspect of the evaluation as a barrier to accessing support and activities, although given the increasing number of online activities currently, there's an argument that that is no longer a barrier as long as people do feel able to engage online. Also, the needs of older people on lower incomes and living in poverty needs to be considered more seriously, because this can be a real barrier to people feeling able to participate in any level and to travel to meetings or be able to engage. And this is underscored by the context of COVID-19, which, as we all know, has exacerbated poverty and inequalities. And also, I've already mentioned the issue of the digital divide and how to respond to that, and how are we responding to that to enable people who may be more excluded now because they're less able to go online? What measures need to be taken? What kind of support and training needs to be given to allow them, as many people as possible, to be able to engage online? Also, an inclusivity strategy is probably necessary at the beginning of any intervention to try and promote involvement amongst older people. We found that it's not enough to be open, to feel that we're open to everyone and wanting to include everyone. We need to actively recruit people from diverse backgrounds to enable more inclusive involvement and genuine active citizenship. This issue came up throughout BAB, as we found that not all older people were as active as others, and not all people responded to the opportunities offered by BAB. And as you can see from the quotes on the slide here, that there was people were very sort of conscious about that. There was a particular lack of engagement amongst Black and ethnic minority communities, and we also found it hard to develop partnerships with other communities such as the older LGBTQ+ communities. Strategic work was carried out on this front, but there were some challenges. So there is a sense, if you want to be more diversity, you have to invest actively in resources to do more outreach and more strategic community development work, possibly over a longer period. And of course, it's crucial to have a diverse workshop that is representative of the different communities you're serving and seeking to involve. So finally, going back to structural context for active citizenship in Bristol and the present situation, what came up several times in our evaluation was that the previous system of neighbourhood partnerships, it was felt they'd been quite successful in engaging citizens, but since they were disbanded, nothing had replaced them. There was nothing sufficient to replace the role they used to play as a channel between civil society and citywide decision making. There are potentially new channels for activity, and if you look at the quote here from the strategy for 2019 to 2022 by Marvin Rees, there's a reference to mechanisms being well established for involving consulting older people, and this emphasis on the cycle of continual improvement. So local neighbourhood partnerships have now been replaced by a kind of citywide approach, a citywide board, and this was clearly a strategic decision. But this raises questions as to how this model can be made to work effectively so people can be involved. How can the voices of older people in the very diverse city, which is Bristol, all be made to be heard with this citywide approach? Clearly that was a strategy that was laid out, and things have happened since then. There's been austerity, we've had COVID, and also the mayoral elections were delayed. So presumably things are moving quite slowly with this new approach, but it'd be interesting to, if anybody knows more, to discuss more what the approach should be taking. So just before we move on to our discussion, I'd just like to say a big thank you to all of those involved in the BAB work. And also here's providing you some useful links and references, things I've referred to earlier. If you want to sort of follow up and do some more reading or watch the video of community researchers, that's all listed here. And to finish off and hopefully stimulate discussion, we just wanted to pose a few final questions, drawing on some of the findings that we've shared today. So the questions we want to sort of start a discussion on really is firstly, if we want a less ageist society, do we need to stop segregating? Should we be mainstreaming participation so it includes older people throughout rather than having separate activities? Second question we would like to pose is about any innovative ways of involving older people to promote engagement and active citizenship. And if there are any participants today who aren't from Bristol, it'd be interesting to share experiences and examples from beyond Bristol if people are happy to share. And finally, given the COVID-19 context, how can we ensure that older people are engaged in the immediate future? And Amy will be talking a bit more about the impact of COVID in her presentation next week. So these are the first sort of initial kickoff questions, and we'd be happy to, we're going to move into the discussion section now, and I'd really like to have your feedback and hopefully you can contribute.
Brilliant. Thank you both. That was great. Really great to hear some of the findings from BAB, and I think you've definitely raised some thought-provoking questions at the end. I think we do have a lot of time actually for questions and discussions, but before we open up to the audience, I'd just like to introduce two of BAB's long-standing volunteers, Judith Brown, who's the current chair for Bristol Aging Better and also ambassador for Bristol Older People's Forum, and also Jan Fulforth, one of the community researchers. So Judith, would you just like to unmute and introduce yourself? Just tell the audience how you've been involved in BAB over the years.
Hello everybody, and thank you for coming. I got involved with BAB as one of the founder members when Kay, Guy Robertson, Mark and Alan from Age UK Bristol got together. So I've been here all along and I've seen it grow, and I'm very pleased with many of the things we managed to do. Of course, we could always have done more, and some might say you could have done it better, but we have achieved quite a lot. For example, I'm 81 years old, and here I am talking to you at a conference. I don't think this would have happened in the past. Frankly, I think you'd have patted me on the head and said, have a nice cup of tea, dear, wouldn't you? So here I am at 81 talking to you about the needs of older people to be respected as individuals, and that's the message above all I'd like to give you. We are all different, we are not the same, and we are like you. The other thing is it's stupid to talk about older people really, because the government is putting it from 50 upwards. That's 5 different generations to the people who are 100, and we have totally different life experiences to you, totally different. And that's why sometimes there's this level of disrespect on both sides, from older people who'll say, oh, what are they playing? They're on their phones all the time, to younger people saying, what's she going on about? She's always on going about war and things. So we are different. We are similar only in that we are individuals. So I've been with BAB all along, and I hope my prayer is that some of the legacy of BAB will be funded into the future, because before BAB, Bristol was very, very, the voluntary sector was cut off from each other, and we had to compete all the time to get funds off the council. After BAB, we've learned to work together, and we formed a very successful hub which has been available to older people and other citizens during the COVID. I think a work disaster, I suppose, is the best word for it, isn't it? So because of BAB, the voluntary sector is more coherent, is more integrated than it was before. And that's a success, I think.
Thank you, Judith. And then I would like to introduce Jan. Do you want to unmute yourself and just tell the audience how you've been involved in BAB?
Yes, hello. I'm Jan Fulforth, and I'm one of the community researchers, and I'm one of the ones that have been involved as a community researcher with BAB since the onset, in fact, before BAB even got the funding. So we've been involved in the whole process of how it has developed. I think during that period as community researchers, we've developed a lot ourselves. Many of us sort of joined at the point where perhaps we were leaving page work and looking for something else to engage us in our future years. And throughout the process, I think we've been able to contribute perhaps some of our experience and learning from other roles we've had, but also we've learnt a tremendous amount ourselves and got an awful lot out of it for ourselves and our own development. So thank you, BAB, for giving us all the opportunity, and thank you to UE for all the support you've given us.
Thank you, Jan, and thank you both for joining us today. Before we take questions and comments from the audience, I think it might be a good idea if we kick-started the discussion with the panel, just with a couple of points that Amy and Joe raised at the end of their presentation. I think both of these points are really pertinent, and also I think we need to use the BAB learning within the city, so these questions follow on nicely from that. Jan, I'm going to come to you first. So one of the points that Joe said was that in order to have a less ageist society, should we be mainstreaming participation so that all activities are for all generations rather than having kind of separate activities for older and younger people. And with the BAB programme being restricted to over 50s, did you think that this was kind of a hot topic as a community researcher? Was it something that you were thinking about the whole way through? What was your experience?
Well, from some of the evaluation work that I did, what I found was that some older people were discouraged by being labelled as older people. The over 50 label, I think, was more acceptable, because certainly to sort of the younger older people. But it did make me wonder whether it's necessary to have any of those labels at all. And I think it's an interesting question, because in some respects, sometimes it seems necessary to target activities, and I'm thinking about something like the Older People's Forum, to actually give a group of people a voice. So I tend to think it depends very much on the circumstances and what you're asking those people to get involved in. What I would say is that in the community research, there were certainly some very good examples of intergenerational work, which brought people together and which seemed to be very successful.
Judith, do you have any comments on that?
Yes, I think segregation is always wrong. I don't think there's any point in it whatsoever. I think everything should be open to everybody. People will choose then what they want to take part in.
Yeah.
It's as simple as that for me.
Amy and Joe, did you have anything to add to that?
Sorry. I think I agree with Jan. I suppose that in some contexts, I think it is important that we do give people that platform. But again, it sounds like a bit of a cop-out, but it is just really contextual, and you need to just think about what it is you're trying to achieve. And in some cases that will be appropriate, and in other cases, as Judith says, you know, it's completely unnecessary to treat older people as a separate entity. So yeah, it's probably not very helpful, but I think it's just down to context, really.
Yeah, I agree with what Amy just said. I suppose what I was thinking was sometimes you do need to target. There is an argument for targeting certain groups, but I don't think it needs to be by a particular age, for example. It's maybe to particular needs of certain groups. So it could be at different ages in terms of mobility, for example, or needing additional support to get out of the home, their confidence building, and that can cut across all ages. So maybe the different kinds of targeting are needed. But I definitely second Judith about segregation can never be a good thing. There's stigma on either side by creating those barriers, I think.
There's a bit of an assumption that older people just want to socialise with other older people, which is just so far from what we found in the evaluation in many cases.
Yeah, and because it isn't an ageist system, I suppose that being older seems a negative thing. I remember working with Jan in one evaluation where people didn't want to just say come along because you're over 50. It's not like making it a positive thing. It's sort of focusing on age is not the thing. It's about come and have fun. You know, we want to get together to do something good. This is a positive thing. It's not because you reach a certain age you've got to come to this. That creates quite a negative package. So yeah,
really interesting. Thank you. Okay, so the second question I just wanted to come to the panel first about was, given the COVID-19 context, how do you think we ensure older people can stay engaged and become active citizens or remain active citizens in the kind of immediate future? Judith, I know that
yeah, one of the most difficult things is, and we skipped over it lightly earlier on, was digital poverty. Information's power, we all know that. And if you're stuck at home up 19 floors in a high-rise flat and you've never had a computer, you've never used a computer, you've never needed to use a computer, you don't have a smartphone, you don't have a laptop, and you wouldn't know what to do with it if you got it, you're cut off. You can't be an active citizen if you don't know what's going on. You can't take part if you don't know what's available. So I think the biggest crisis facing, hopefully, the next two generations from me, the 60s and 50s won't have that problem. But the one directly below me, the 70s, and the two after me, the 90s and people who are 100. We have that problem. So that's what we really need for people. I honestly believe that if the NHS used some of the money it spends on big meetings, and I've been to so many of them, on giving every old person a laptop, and somebody's come and show them how to switch it on and use it a little bit, half the surgeries would empty at a stroke. I mean, right now we don't go to the surgery, but you know what I mean. Because when you're focusing on something, like I'm focusing on this, I can't feel my knees at the moment. You can see my hands, they're deformed. I can't feel my hands because focusing on something outside yourself lessens pain. It's a solid fact. So I think that's where my generation and the people above me are losing out. They don't have access to the information they need to be an active citizen.
I think that's exactly right. But I would also like to just put a slightly positive spin on it, is that if we can overcome that digital divide and if we can get everyone connected, then there's great potential that COVID has raised for us, because before we weren't doing this with older people, and it is a way of reaching those who are very socially isolated. So if we can get older people online and connected, there's such opportunity there to reach those people who were very socially isolated previously. And people, don't have to go out at night. They can log on wherever, whenever. They've got caring responsibilities, they're able to log on. So as Judah said, it's a massive problem, but if we can overcome it, there's great potential there, I think.
Yes, there is great potential, because so many people are being wasted. Their skills are not being used. Their knowledge of life is not being used. It's how we get it there, how we do it.
Can I just add something about, because I work in public involvement, how generally when we have people getting involved, we pay them for their time to come and attend meetings, and we realised we had to make a big shift there about trying to support people to have access to an internet package, because a lot of people, we realise, are living sort of with a very reduced package, and then when it runs out, they don't have any way of communicating online for the rest of the month, and that's come up across all ages. So that's there's a sort of digital aptitude thing, there's the actual access to gadgets, there's also what kind of internet access do you get, because a lot of people use libraries. Of course, during lockdown they couldn't go to libraries, and that's a very limited time space as well. So it's actually having more sort of policy making to ensure that every member of the population has decent and affordable online access, which I don't think has been taken seriously across the country yet. So there's various aspects to this digital divide and digital inequality.
Incidentally, can I just say one thing more? You said about consultations. Bristol City did agree, and has been carrying it out ever since I got them to agree it, that they will provide paper copies of consultations for people who are not online. And how they find out about it is we tell them in our newsletters, so they can ring a number, and the number's in our newsletters, and ask for a paper copy.
That's great.
Brilliant. I'm just going to invite members of the audience, if you have anything that you would like to share to bring to this conversation. Some of you may already been working around these topics, trying to get older people involved in the work that you do during COVID. So if you have anything that you would like to share on this, then please do raise your hand and we'll come to you. Likewise, if you have something that you'd like to ask the panel, particularly about the BAB evaluation, or just in general about active citizenship, then please again just raise your hand. Particularly interested to hear what people have to say about this, because it's such a topical issue. So, okay, I'm just going to ask you another quick question. We talked about earlier about encouraging and empowering older people to kind of get involved in active citizenship. Do you, Joe, or well, actually anyone actually, do you have any tips to encourage people to become leaders within their community, or leaders within activity groups specifically, rather than just kind of getting involved in a group? A tricky question.
Jan. Yeah, Jan. Probably.
Yeah, it's just a thought in some ways, I think leader is quite an intimidating term, and certainly in the groups that some of which I went to and talked to the participants, what seems to work well is when people actually shared roles rather than expect one person to do the leading. And I just wonder whether that can be applied in the same way to getting involved in democratic processes and things, that people don't feel that it's all on them, but that they have, they're perhaps giving a voice to other people.
Yeah, I think that's been one of the findings from some of the community development projects in terms of having those groups, is that having shared roles where people know what they're doing when they turn up to a group is actually really helpful, shares the load and responsibilities out. Yeah. Judith, did you have anything to add?
No.
I think it's hard as well, because as we said in the presentation, you don't want to just kind of always have, because you do get those people within communities who are very active and very engaged, and that's brilliant, but we just don't want always the same people coming forward. So it's kind of about nurturing perhaps the quieter people who aren't less obviously leaders, but kind of really kind of through the skills and the training support that we talked about as well, kind of building up their confidence to be able to do that.
And you've mentioned training within your presentation as well, and I think within lots of the BAB projects there were older people that took that leading role within some of the community groups, but in terms of that strategic work, I think it's been we've seen less of that really through the BAB programme. Do you think that we should have more training on offer to help citizens who'd like to be involved in strategic work? Do you feel like that would kind of support people along the way to get involved in that, that level?
I think so. I mean, I worked on a similar project about kind of sort of training up people to be able to speak at high level meetings and things like that, so that they can in like a healthcare participation role. So I think there's potential to do something similar to kind of, but as I say, build the confidence in people to be able to talk, you know, on an equal basis to people who they previously perhaps wouldn't be sitting around a table with, because I think it can be quite intimidating, perhaps particularly for older people who maybe aren't in the world of work anymore, and that sort of suddenly feels quite daunting to kind of get their confidence back. And that older people have so many skills in these areas that we can draw out and would be so valuable. So yeah, I think that would be a really good idea. Yeah.
Training is just that, I mean, obviously training would be useful, but I suppose one-off training where then you're left to sort of try and implement it yourself it can be challenging. So more sort of mentoring as well, I suppose, or shadowing, working together in combination with training, I would think would be quite helpful.
Yeah, because that's one of the things that was successful about the community navigators, was that they had that supervision throughout, and so somebody to talk to and bounce ideas off about their progress. So yeah.
Brilliant.
When we had the Older People's Partnership Board before, we did think that's what was needed. There were many people on that board from various organisations, but it's easy to be intimidated if you're not used to public speaking by officers who appear to know more than you do. And you may think, my ideas aren't valuable, I can't speak up here. That never stopped me, mind, but a lot of people, it did stop a lot of people. And I do agree that if you're going to have something like a new partnership board for older people in the city, you want to make it plain that we can help you use the skills you've got even better.
Yeah. And that's not just...
If you say we can offer you training, that's just off-putting. Oh, training, do I really want to, I don't know, do I want, it's back to school. No, don't say training. Say, you'll have to find a better group of words.
It is definitely about wording, I think, it's really important.
Yeah, and what Julia's saying isn't just the case for older people, you know, young people panels, anything like that, where
anything,
you take part, you need to be able to make them feel confident enough to have that voice. Yeah.
And we've had a couple of comments actually come through. Tracy said that she thinks that it's about networks that people have, the people they know in their community, who they talk to and who they can sound things out with, as well as training that's available. Okay. Just going back to the digital exclusion kind of points that we were making earlier, someone said that there is sometimes a lack of willingness to get involved with the digital side of things, even when there is support to get online. So does anyone here have any thoughts on how we can address that lack of interest and encourage people to engage in digital inclusion, I suppose?
Well, there's the family, isn't there? Everybody wants to stay in contact with their family. And so you could say to them, you could talk to them every day on a thing called Facebook, or you could use a thing called Skype, and then you'll see pictures of your grandchildren in Manchester or whatever. Or you could say, you used to love singing, Mum, didn't you? Well, you can sing online with people from all over the world in a thing called Sofa Singers. Or there's so many things, there's so many opportunities. So you mustn't say, oh, it's all technical, don't worry, you'll soon get used to it, I'll teach you. It's let me show you how you can get to these things, because it's brilliant.
Mm. It's that incentive, isn't it, I suppose?
Yes.
Sorry, Jo.
So I think it's about seeing the benefits of it. But I must say, I do know older people who have not embraced it still and actually prefer to speak on the telephone to people. And
oh yeah, yeah.
And then I suppose there is the option of phoning into things that you might. I think we have to be aware of that. And some people just want to wait and get back to their normal, however they can, rather than. And we all know that we all embraced at the beginning, didn't we? How great it was, everything's online. And then we all get really tired of Zoom meetings. We get tired of the online. We can't wait to close our laptop. So. Maybe not assume that everyone has to and wants to. It's hard, isn't it? It's hard. There's no answer.
Well, I think Manchester Ageing Better have produced that report about social contact sort of during COVID, and one of the things they've talked about in there is people having a network, so that one person rings the other person in the local community and checks on them, and then they ring the next person. Yeah. So there's other ways of kind of keeping people connected that don't rely on.
I think there have been a lot of volunteers in Bristol I've known of who've done that. They've just done the phone slog, just phoning, phoning people regularly, so they know they're going to get that call and someone to talk to.
Yeah. I think, as you say, it is about having the different options for people, because not everyone's going to want to get online. And Sue, hello, did you have your hand up?
Hello, I just want to share a little bit my experience from my project, because my project is called Food and Nutrition. It's Bristol Mr. World. It's use of food to connect the people from diverse backgrounds. So before we do the face-to-face sessions, and since the COVID-19, we shift from face-to-face to the online sessions. Mm-hmm. So because also is funding by BAB and St. Monica Trust is for the elderly. So what we do, we work with the community first. Then we still encourage the elderly to record their videos online. So they will support by their families. And also we support people, they don't want to, they maybe have no IT skills. We set up kind of WhatsApp group, because they just got filmed. They won't be able to log on the Facebook. They haven't got Facebook account. So that means we need to like discuss with the community, like the people, and to see what the way, like WhatsApp group set up, like we send a video to individual. So we make sure the video need very short, because if it's not very long, you can send it. And also we find another solution, maybe burn it into the DVD to give the care home people, and people can watch the from the the DVD players. And also the newsletter, we make it in the language, translate into their own language, because we got Bangladesh, we got the Pakistani, we got the Chinese free community. So in that way, to still stay connect with the elderly during the COVID-19, because we don't know how long we still need to live with the the virus. Because at the moment, maybe 1 year, maybe 2 years, at least you got the vaccine, people will feel confident and comfortable to join the big gathering. So that's a way, from my point of view, find a solution how to still let them to be active, be occupied, be engaged. So yeah.
Thank you, Anne. Yeah, no, a really interesting project where you've connected people to get online, but through their families, and really supported them on one-to-one basis, which I think is really important. Penny, I think you had your hand up at one point as well. Did you want to unmute yourself?
Thanks, Laura. Yes, I did. I was just going back really to the what was being said about decision making. And sorry if this is going to be a bit of a political point, but but I do think that people, since the introduction of the city mayor, and I'm not commenting on either of this, Marvin or George, who have been the mayors, I do think that that has made decision making more remote from people, because it's concentrated in the mayor and the people that he or she presumably would have around them. And I would like to see that the city mayor role abolished, quite frankly, and to go back to the previous system of having councillors make decisions alongside, as Judith points out, the expertise of officers who are employed there. One of the things that slightly worries me, I just scan reading Marvin's statement about establishing an age-friendly board. I'm a bit worried that that might be seen as sort of even, I think there's a risk, although I think it's a good idea in some respects, that that will be seen as very remote from people, that it's the age-friendly board that are, you know, are doing stuff. And that sort of, although I think that there should be some sort of established system of representing older people, as well as in a similar way to other interests, to those that are making decisions at the local council. I would prefer, I really think that it's important if people who aren't normally participating in, as we talked about right at the beginning, participating in their local community in whatever way, I think it has to be done really at a micro level. I think you have to go back to the people, you know, distributing leaflets on streets so that people know what's going on, which sort of feeds in also to the problem with digital poverty. So sorry, that's a little bundle of things that would just come from notes like that. Can I just say it's been really interesting, and thanks to everybody who's been involved.
Thank you, Penny.
Penny, we used to work together in the HTV Good Neighbour show. Do you remember? Many years ago, back in the 70s or 80s. Yes, it was lovely to see you. How can I forget you,
Judith?
The Older People's Partnership Board, as was, I don't know why they dropped it. Well, I do know why. It was money, wasn't it? They didn't want to spend officer time sitting with a load of old people. But now it's all, everything comes back. So now it's all in favour again. But it was composed largely, there were people from voluntary organisations, including BLPF, obviously, and half of the board was us, and half of the board were officers from the various directorates. So it was a way for older people to get some sense of what their members were saying over to the council. We used to have co-options onto the council, Penny. Now I'm the sole remaining one on the, it's now called People, but it's the old Health and Safety and Security Board. But I'm the remaining stand-up. I'm the last woman standing. And I do hope that maybe they'll consider having co-options again. It doesn't cost them anything, apart from my life, my time.
Yeah, I wasn't saying we shouldn't have it. I just feel that it's it can be seen as that's what we're doing, and forget the rest, really.
Yes,
that's my concern, that it needs there needs to be more involvement, as I say, at a more micro level.
Yeah.
I think as well, it goes back to what we said in the presentation about how people want to participate at different levels, but the important thing is that they all need to speak to each other, and they all need to, information needs to go up the chain, so that when you do get to that age-friendly board, what's happening at the bottom is being talked about at the top.
Yeah. Really interesting points. Thank you, everyone. Do we have any other questions from the audience or any other comments? I can see that 100% Digital Leeds have shared their project, which is amazing. We could, everything that's talked about in the chat or anything that's shared in the slides and presentation, and afterwards we'll share with everyone afterwards. So you, yeah, you get that information as well. So do we have any other questions? If not, I may have one actually that I've prepared earlier. Okay, so I'll go with my question. So you've talked a bit about door knocking and how that worked well for some areas, but you felt that it was when conducted by local residents in some of the projects. Is this a strategy that you would recommend for future projects if projects wish to engage with local residents? Obviously it's a bit difficult within COVID times, but outside of that, would you say that door knocking was beneficial?
I think door knocking can be really time consuming, and sometimes it works well, and again, contextual. Some areas probably more kind of open to it than others. But yeah, there was some evidence to suggest that where kind of local people were doing the door knocking, people were much more prepared to engage than if someone kind of appears on a more formal basis. So, and preferably someone who kind of lives in the local area and knows it well. So again, that kind of peer-to-peer conversation can happen rather than kind of somebody who seems quite abstract and distant turning up and asking questions and they don't even live there. Yeah, sorry, Judith. Yeah, that's all I say really. It's a bit of a funny one, door knocking, because I think it can sort of be quite a waste of time sometimes if you don't get the responses, because as I say, it's so time consuming. But even if you get a few good ones, it can be worth it. So I think again, you have to just judge on what resources you've got available and whether you can rope in some volunteers to come with you and do it with you.
Great, thank you. Any comments from anyone else? Okay. Oh, go on then, Jan.
Yeah, just that sometimes because door knocking is so time consuming, some of the strategies seem to work well in the community development projects, and one of them was having pop-ups of different kinds on sort of strategic routes through the city where lots of people congregated, and that can involve local people as well. But it's another way of trying to reach people who live locally.
Yeah, that's a really good point.
Penny has her hand up as well.
Oh, go on then, Penny.
Yes, I was just going to say one of the things that I think you have to be careful about with door knocking is that you need to have something very specific that you're door knocking about. And otherwise I think that if it's sort of, do you want to become more involved, do you want to do that, I think it can be too vague for people. I think there's a risk that, I don't know about the rest of you, but if people knock on my door in the evening, I always wonder who it is. It's normally somebody collecting for a charity, and by generally speaking, I will say no, that I don't make decisions like that on the doorstep. So I think that it can be quite problematic, particularly for people perhaps who live on their own, who wouldn't expect to have somebody knocking on their door, that they feel obliged to make a decision there or then, so they might be more likely to say no. But also I think if you're going to do that, you do need to have something really quite specific that you think people will be concerned about, so that they can have a think about, and to leave literature. When I say literature, I mean information about what you're doing, so people have, and contact details, so people have time to get back to you. I think that's what I'd say. It's it doesn't one of the areas in fish ponds greater fish ponds that we looked at, that people just weren't interested, and regardless of who went, really, who was door knocking, they just, it was a sort of defensive reaction. So yeah, that's the point I think.
Thank you, Penny. Yes, I think it raises again the same point about having different ways of people being able to engage, and as you say, leaving your contact details, because some people might not want to sign up to anything then and there. They might want to have time to think about it, and yeah, just giving people different options. Okay. Anything else from anyone before we? No. Okay, well, I think this brings us to a nice close. If there's anything that you've thought of after this event, then please just get in touch with us and we'll answer your questions or pass it on to Yui or any of the CRs as well. As mentioned today, obviously, this is the second in the series of the BAB events this month. So if you're interested in hearing more about the key findings from the BAB evaluation and you haven't already signed up to the next session, then please do. So the next session is next Thursday, the 22nd of October. The focus will be on building community assets and sharing the key findings from community development projects. If you can't make every session, then don't worry. All of our events will be available afterwards on the BAB YouTube channel. We will also send this out to you in an email as well with all of the links from everything you've heard about today. We have revamped our website, as some of you may have noticed, and this includes a new learning and evaluation hub where we'll be uploading all of the final reports from Yui and the community researchers, and also any additional learning from the programme outside of the formal evaluation. So we will circulate the slides after the event, as I've said, and I would like to take this opportunity to say a massive thank you to everyone for coming today, and also to our speakers, Heather, Amy and Joe, and our volunteers, Judith and Jan. And I hope that we see you again very soon. Thank you very much.
Thank you for coming.